WGN investigates Cook County's growing opioid epidemic and how police find themselves on the front lines.
WGN investigates. Ben Bradley has the story.
Opioid overdose deaths have spiked during the COVID-19 crisis, on pace now to more than double from previous years. But lives are also being saved. It's a reminder that cops do more than clamp the cuffs on criminals. Every day throughout Cook County, the calls come pouring in.
He's breathing, but he won't wake up. I believe they both take drugs.
Reports of opioid overdoses, like this one at a motel near O'Hare.
Hey, man, hey, yo, wake up.
Or this one at a Fort Heights bus stop.
Sir, come on. I need you to sit up. What have y'all been on? What have y'all been taking?
He couldn't respond, so we administered Narcan.
We're gonna see if we can wake him up.
But when that didn't happen...
Listen, I'm gonna put this up your nose. I'm gonna need you to inhale, okay? Come on. I need you to breathe.
Come on, man. Let's breathe, man.
Come on.
The ambulance is almost here, okay?
The men in both videos survived, thanks to the officers' quick thinking and their having Narcan.
Hope that person comes back right away.
Because without the life-saving overdose antidote,
He could have lost his life that day.
others haven't been so lucky. There have been 810 opioid overdose deaths so far this year, per Cook County records. But with hundreds of autopsies still pending, officials fear the actual number is much higher, nearly eclipsing the totals in each of the last 2 years.
I consider it a public health emergency.
One made even more challenging by the pandemic and the limitations it places on government agencies and social service providers.
We have a total of 5 clients that have passed away, and 4 have been during the pandemic.
Ellie Patak Montgomery is with the Sheriff's Treatment Response Team, an outreach program launched last year that works with drug users, helping them find treatment and other services.
We find a lot of people that are in this neighborhood that are suffering from addiction.
Let's go, guys. Let's go.
All right, let's go.
Be safe.
Our cameras were rolling back in January as the team canvassed a West Side neighborhood.
You give me a call and I'm gonna help you. All right?
Passing out Narcan.
So she came up to me and asked me did I have Narcan. So I told her we did.
And a dose of hope.
Hey, we come in peace. I don't want no trouble.
We're just trying to get people help.
Is we help people if they got any problems with substances.
Due to the pandemic, the team is not working the streets or meeting face-to-face with clients.
If you call, we'll help.
Making the tough road to recovery even more difficult.
And hear people, suffering and crying on the other end of the phone, it's not the same thing as being there and really holding their emotions for them.
To help find new clients, the team tracks emergency calls, following up with users like the ones we showed you.
Everybody in here?
Police found the man slumped over in the bathroom within inches of losing his life.
We walked in the room, he had a needle in the sink. So we knew he had taken something. My adrenaline was going through the roof.
The man did not respond until he was given Narcan.
Grab his other arm. Tell me your name, man. You're gonna be fine.
Already this year, Sheriff's Police have responded to 70 overdoses, up from 40 during the same period last year. They've given Narcan in 28 of the cases, compared to just 5 times in 2019.
Our officers are on the front lines. They're the first ones arriving on a call of an overdose.
Not only on the streets, but also the political arena. In the wake of George Floyd's death, there has been a push to change how police operate, both nationally and here at home.
Now, we have an opportunity during one of the most unprecedented times in our nation's history to actually set a new course.
With a nod to the defund police movement, Cook County Commissioner Brandon Johnson recently introduced a resolution to divert money away from the sheriff's budget and to housing, healthcare, and other community services.
If we don't change course, we're going to continue to get what we've received so far, which has been inadequate.
I had already scanned the country.
The sheriff says law enforcement overall needs to change, but he says his office has already done so in so many ways. The treatment response team, just one example.
I get what the defunding movement's about, but they're going about it in a way that is one size fits all and not with a lot of thought.
We don't just arrive with handcuffs and guns, but ultimately, whenever we get to a scene, our first obligation is preserve life.
Neither of the men we showed you were arrested. As for the overdoses, there are about 600 pending autopsies. The medical examiner's office says typically about 70 to 80% of those will be ruled opioid related, and that would bring this year's total number of opioid deaths to more than 1,200 in Cook County. And we still have more than 5 months to go. Ben Bradley, WGN Investigates.